Hey everybody, and welcome as always to another exciting edition of MedHeads, MedCityNews.com's conversation on innovation on the business side of healthcare. I am Chris Sepper, joined with two-thirds of the MedHeads crew right now. We're going to talk about Alphabet, aka Google. We're going to talk about their challenges. We're going to talk about what their real designs are in healthcare and what evidence we've seen of what they're actually really doing in healthcare. We will be joined by Mark Bergen, who is the Google reporter for the amazing tech site Recode. Mark reports that he is in traffic and that in San Francisco the Super Bowl has ruined everything. Mark, we're still with you, brother. But in addition, joining us is the woman you've seen on the screen this whole time, Meghana Keshavan. She covers life sciences for MedCity News and regularly writes about Google. Meghana, how you doing?
Dandy.
Andy. From Philadelphia, our digital health editor, who has been writing about Alphabet and Google as well, and actually tuned into those exciting Alphabet earnings, is Stephanie Baum. Stephanie, how are you?
I'm doing all right.
The level of fascination when it comes to Alphabet and Google and Verily and all things healthcare is obviously at an all-time high. I think that people think about Google and they get excited because they see moonshot, big thinking, amazing opportunities because of the way that Google and Alphabet approach things and their big, deep pockets. I think as one of Mark's stories talked about, it's essentially a university run off of click ad dollars, and there are tons of those to go around. This week was important because this is the first time since Google made Alphabet, pushing most of its Google tech stuff to one side and its moonshots to the other, that people thought they were going to get some insight into how Google and Alphabet operate and maybe even how much money is being spent on some of these big, amazing things. Stephanie, you actually listened in on these things, but what you found was that there wasn't as much about healthcare as we thought or maybe hoped, but there were tons of interesting revelations that healthcare should pay attention to. Why don't you run that down for us?
Sure. I mean, yeah.
Wait, I gotta hit the pause button on you, Stephanie. We are joined by the Super Bowl ruined Google reporter from Recode, Mark Bergen. Mark, how are you?
Hi, I'm apologetic. I'm so sorry.
No problem. None whatsoever.
Our office is in the middle of Super Bowl City, so we have like bomb sniffing dogs and metal detectors and all that fun stuff. So that's my excuse.
No, that's great. And we were literally just getting underway. We just did an intro talking about Alphabet's earnings and the expectations of what could be heard. So this is the perfect segue into you. You live blogged it, and you obviously follow Google and Alphabet intensely. Talk about some of the expectations here. What were the Alphabet earnings like overall, and any insights that you were able to glean about Verily and its healthcare and Alphabet's attitude toward it?
Sure. So, I mean, I think the overall picture, I guess, this might be repetitive. This is the first time that they've done segmented reporting. So they had two different lines, basically. One was for Google, which is Google we're familiar with, the search business, Android, YouTube, all that fun stuff. And then what they're calling other bets, which is the 8 aggregate businesses now, including Verily and Calico. And the only numbers they've shared were, the interesting numbers were CapEx for the year of 2015. So those businesses in aggregate cost about a little, I think it's $850 million. They lost about $3.5 billion, and they brought in revenue something close to $500 million. And those came from 3 different sources. There's the Google Fiber business, which is their broadband internet, Nest, which is their company that sells smart thermostat, they have a smart camera, smoke detector, and then Verily. So I can say with confidence that Verily made less than $490 million. My guess is that it was the smallest of the 3. But it was also mentioned kind of briefly. Ruth Porat, who's the CFO of both Google and Alphabet, mentioned Verily as one of their ideal Alphabet businesses, and I think because it's very independent. It doesn't even have Google's name attached anymore. It's autonomous. Like Andy Conrad runs his own show, and they have a business that's very separate from Google's core internet business. So that's sort of, go ahead.
No, go ahead. So Stephanie, that's it. We wanted to segue into you. I think that a lot of people in the medical industry were really looking for lots of evidence. It didn't come. but you still thought that Google was doing and Alphabet were doing interesting things that healthcare should pay attention to. What were your take on that?
Sure. Well, where I saw the most relevance, and it was aided by a specific reference by Google CEO Sundar Pichai, I hope I'm pronouncing that right, was on the Pichai, thanks. Was on the Google Cloud business. Last November, it acquired Bebop, which is an enterprise development platform run by Diane Green, and last fall it restructured its Google Cloud business, and she's basically running it. There were specific mentions of a couple of the tools on the Google apps and Google for Work side that I thought were particularly interesting with thinking about healthcare. One was Smart Reply, which is basically using machine learning and blending that with email. So basically it's looking at your email and saying, okay, what are things that you can reply to fastest, and here is a way of predicting how some of those replies could go. And another area that kind of dovetails with that is TensorFlow, and that is a deep learning tool that is looking at image that deals with image recognition and video recognition as part of that. I just thought that I can think of a lot of different applications in the realm of healthcare for that, but a specific healthcare group that was mentioned as a new customer was Catholic Health Initiatives as a Google Apps for Work partner.
Did you, Mark, and let me ask this, both Stephanie and Mark, and I guess I'll go with you first. Will we ever, you made a mention in your live blog, kind of, you laughed at people who thought that splitting up the company would change the way that they disclose information in the company or report the earnings. Do you think that we'll ever get more deeper or revelatory information about some of these moonshots while they're in the pre-revenue stage? You know, yeah, go ahead.
Probably not, but maybe the FDA would it might be that Verily would be forced to disclose for regulatory reasons, whereas other companies may not be able to. That could be the case.
And and do you see the synergies? Stephanie talked about some of these healthcare synergies. Do you observe that in the day-to-day of covering Alphabet and Google? Just a design on healthcare in a bigger sense.
Yeah, you mentioned TensorFlow, which is I think really interesting, and a lot of their machine intelligence, their AI research, DeepMind is that crazy deep learning company they have in London, and I think they're talked and thinking about like medical diagnoses, right? Being able to process a large amount of medical data, and I think they're thinking about healthcare applications pretty regularly. So I think there's going to be some intersections, and I know there's some machine learning team inside Verily that is thinking about the ways they can process health data.
Well, there's a bigger question at foot here, and I want to bring in Meghana. There's a constant question I think a lot of people are asking, right? Is this science fiction because so much of it's PR right now versus kind of actual product beyond ideas? But then there's this question of how big is Google going to get in healthcare, and we had an amazing opinion or prognostication to kick off the week, Meghana, when you were in Boston from a Biogen VP, and they're a partner of Google's. Can you recast what he said and give me your take on it?
Yeah. So he was speaking just generally about Google's healthcare strategy, and Biogen has partnered with Verily on some multiple sclerosis work. I think they have wearables. You wrote about it, Mark. I actually cited your article in my article.
Thank you.
You're welcome. But it seems like they've got Biogen and Google are building their relationship, and so this guy Adam Koppel he said that he said that Google will tell you directly that it is attempting to become the next CMS or the next Centers for Medicare and Medicaid Services, which is a pretty bold claim, and his rationale for it is that Google has this really powerful analytics platform that most companies don't have, even insurers aren't really on the same level. And so if Google can pool a bunch of data from different companies, different health providers, they will have the power to potentially replace something like CMS, which is actually a pretty polarizing thing for Koppel to say. And I have to say, like, our comments, and like, there was a lot of dissent among the Twitter feed, but other people were like, wow, that makes sense. So Koppel's rationale for it basically was just that Google has been in this like space of trying to compile electronic health records for several years now. It had that failed Google Health attempt a few years ago, and then more recently it continues to be involved in voluntary studies where people will. I think it's a 10,000 patient strong study where Google is involved in analyzing their data. That's what he said anyway. So
that's the baseline study?
Yeah. So it was an interesting, very bold statement from this Biogen VP who was quite certain about it. I went and talked to him about it in a little bit more depth because he said it initially on a panel.
It does seem, I mean, in some ways it makes a lot of sense, right? I mean, if we think about where they would go, and this is just an old anecdote from a few years ago, Google X often recruited healthcare people to kind of think of big moonshots, and one of them, who had been a big executive at a health insurance company, had come to me and we were talking, and they said, we just want the biggest ideas we could think of, and one of the ideas that he and I kicked around was, why wouldn't Google take over or ask the federal government to outsource certain areas that require tons of data and standards? And the idea that was kicked around, and this I don't know if this ever made it to X or not, it made it to the phone call I was on with this health insurance guy, was why doesn't Google take over, checking on food regulations and data and taking on these massive tasks that require data. But payers, being a payer means a lot more regulation, a lot more adherence to things. So it seemed like it was out of the blue. Mm-hmm. But Stephanie, Google, at least in Google Capital, they're invested in the next generation of payers anyway, right? I mean, you've written about this before.
That's right. And actually, you wrote about this as well. There was the article I was thinking about was last September. I think there was a New York Times article in which Mario Schlosser, who co-founded Oscar in 2012, and Oscar is pretty much like a startup payer, but a new generation of payers in that they are leveraging new technologies and apps and trackers and telemedicine to engage people in their health management and trying to help them make smarter health plan choices. But the co-founder of Oscar in 2012 said part of their goal was to help fuel the adoption of new healthcare technologies developed by other companies. And Google, whose life science arm is developing contact lenses with Novartis, for example, among other collaborations, they could eventually work with Oscar to help distribute these types of new medical products to patients. I think his exact quote was, Google right now would need somebody to get these contact lenses to their patients, and that somebody would have to have some economic incentive. We can connect all those dots. So that was kind of a telling remark, and maybe that'll prove, that'll prove fruitful in the near future.
Is there a cultural overview that would give us hints on where Google would go with some of these things? I mean, every different healthcare sector would love a piece of Google because they think it's imaginary, that it's deep-pocketed, and it's not as, I guess, ROI driven as your average VC. But Mark, as you think about the company and how they're trying to coalesce everything from Nest, to some of the Verily moonshots, like, is there an identity that Google crafts around the partnerships and the things that it undertakes?
I was just saying that when you say coalesce, because I think that in some ways they're trying to fragment themselves a bit, mm-hmm. right? They're trying to give these alphabet companies their own independence. I mean, that's at least lip service, but my understanding is, they want Verily to operate as its own startup. essentially, right? Because Google, the alphabet right now is 61,000 people, and in some ways its biggest problem is that it's a massive bureaucracy, and getting things done is just hard. And so I think like Larry and Sergey really wanted they want to do these big moonshots, life changing. They just
You say massive bureaucracy. I think that would be positioning it perfectly to be next CMS, by the way.
Yeah, that's they could be. It's a perfect move into healthcare.
But see, like my approach to that is, why aren't they better served by being a technology company that can serve payers rather than actually needing to acquire a payer themselves?
Well,
I mean, I guess Google, because to take a step back, and Google's never really done anything like payments well. That's not something they excelled at. And in the medical space, I mean, they've not done hardware well. Kind of the Verily line is we're not selling anything. We're kind of like an R&D lab essentially. We do data really well, and we do software really well, and we do kind of the crazy moonshot bets that no one else is willing to invest in well. I mean, it's interesting that people like there are not many people I've talked to that are close to Verily, but those that I have say that there's a little risk that they're kind of trying to do way too much, and they haven't really kind of jumped on ones. They haven't kind of formed like a business plan essentially. So maybe, I mean, that could be the Biogen. They could be telling everyone, yeah, we're gonna do that. We might be a payer. We might take this approach, and they're possibly kind of exploring as many avenues as they can for now.
So almost as if Alphabet is in its wistful stage when it comes to Verily, or Verily is in its wistful stage. I mean, it does seem like the nearest term benefit that healthcare is going to get out of a Google is cloud, right? I mean, Amazon, Microsoft, Google, all fighting over cloud, and that is probably one of the most important spaces for healthcare. I don't doubt it's going to even go into HIMSS, the big healthcare IT conference. I think that it seems that cloud is an industry overall as an industry, but in healthcare specifically seems to be ramping up. And aside from mobile, which obviously Google cared a lot about, that seems to be where the money's going to be. Stephanie, you talked a little bit about that in your piece?
Sure. I mean, especially on the storage front. I mean, they're still competing with the likes of Amazon and I hope I'm not wrong about this, Microsoft channel on that front. But I mean, it's interesting when you think about the Google apps and how collaborative they are. It seems like if I think about on the healthcare side of things and the possible applications that we were talking about earlier, I mean, you think about like some of the biggest problems in healthcare have the simplest solutions. There have been studies that have shown that if people are given timely reminders of their appointments and say when they need to take their medication, then it can have a huge impact. And this is such a simple thing, getting a text message or getting an email. What if they could use that technology that also combines machine learning to apply those things to email and text messages in collaboration with healthcare systems. You also have this image recognition tool that they developed, TensorFlow. There's a company called AI Cure that developed an image recognition tool to ensure that people take their medication when they're supposed to. Initially, it was developed to support clinical trials so that you could have more reliable remote monitoring system so that people take their medication when they're supposed to without having to have someone on site confirm it. That's another possible direction they could go.
Stephanie, we're getting the special Philadelphia internet again with you. Mark, I know you've never been on a MedHeads before, and we don't know. I lived in Philadelphia. I love the city, but for some reason, Philadelphia internet just fights you like the fans of the football team, right? It's amazing how bad it is. So, Meghana, let me ask you a question here. Of all the things that you know about Verily and what they're doing, what's the one that excites you the most, and what do you think is the most probable?
Well, for me, it's probably the mental health applications. I think that it's kind of low-hanging fruit, and I don't know. I've talked to a lot of psychiatrists. My parents are psychiatrists. And it's fun and
what's the fruit? I know nothing about what the fruit would
Oh,
be.
sure. Okay. So the thing is about the mental health industry and about psychiatry in general. It's about 2 decades behind the rest of the medical industry. They describe the psychiatric drugs on the market as like, blunt tools that are just like not really attacking these like very specific problems that people have in terms of mental health.
Yeah.
And what I mean, I'm sure you know that, Verily coached Tom Insel, who is the former National Institute of Mental Health director. It was a pretty huge, move. And he's really interested in, obviously, the digital health applications in psychiatry because, Google has the ability to track and gather metrics and figure out these digital biomarkers, which are a lot more powerful for something that is measured as subjectively as psychiatry. Like, I mean, if it's a heart disease, you've got a statin to control, blood pressure, whatever the hell. Mm. But psychiatry, it's too far behind, and so I think that creating interesting new apps that can either track a person's mood or a person's like likelihood to have a psychotic break or something like that. There's a lot of potential there. And like I said, I've got a little bit of an insider view on it because my dad does research in that space. But, there's just a lot of potential there. And for instance, I think that, is it Verb Surgical that's got that partnership with Johnson & Johnson? Like, that's a little different, but that seems a little bit further out, getting, surgical tools. What's that?
I was just saying that the medical robots are a little bit further.
I mean, I'll play the game. Yeah. I'll play the game.
Yeah, so I'm just saying, like, robots.
Oh, good.
Go ahead, Chris. The internet's being weird in San Diego too.
And I'll play. Okay, sorry. It's bad internet all over the country. No, I would say I think that's interesting. I mean, I think the place where Google's going to lose the most money, or Alphabet, Verily might, and everybody chases it, is around diabetes. I mean, I think the contact lens and around the monitoring of diabetes would be probably a test to see how serious Google is in the life sciences space. I think they've got, one thing we haven't talked about is the personnel. We mentioned earlier, Mark, you mentioned early on Andy Conrad, and they've got a whole host of other people that are really highly qualified. But the cost to bring breakthrough diabetes treatments and approaches is monstrous, and littered with long, laborious and products that the biggest companies like Medtronic and others have tried. I think that Google's got the pockets for it, but will they have the patience as the years go by and the breakthroughs work or may not work?
Well, what I've learned about that Dexcom technology that Google's partnered with is that, the core technology is already pretty powerful for type 1 diabetes, and so it's just a matter of creating a more disposable platform for type 2 diabetics, and then they could technically expand into that market easier. So I think that's kind of the mid-grade fruit, I don't know. I agree that it's a test, but I think that it's a realm of possibility to succeed in the diabetes market, because I think that if you could get a continuous glucose monitor type thing for a type 2 diabetic, that would be A, highly useful, and B, it's within the reach of possibility, I would say. That technology does exist already. It's just a matter of refining it, which I think Google could do. But that's just me. I'm an optimist.
Mark, what do you think people are going to see coming out of Alphabet that you think is either that you're most excited about, or other people would be just really surprised and pleasantly surprised by?
Yeah, I just get terrified. I don't get excited about them. I do think there's a couple of things. One, we're talking about the kind of crappy internet connection. I mean, Google Fiber, they've had this for a while, so it's in a fiber optic to high-speed internet. And there's a lot of different theories running around for why that is. One is sort of, they just want they want Comcast and AT&T to start delivering faster internet. You get faster internet, you can stream Hangouts, you can do YouTube. And so that's sort of they're spending money to push the industry forward. What's good for the industry is good for Google. The other theory, which I sort of like, is that Google sees a lot of the future and say medical robotics, telemedicine. That requires really, really good gigabyte internet. And so in order to get that, that's the kind of their play is to push that forward. So I do think they're going to start talking a lot more and being more aggressive about their broadband strategy. It's going to be fascinating to see like how they compete in that industry. We didn't talk yet about virtual reality.
Yeah.
Google's virtual reality and augmented reality. They've been kind of ever since Glass kind of fell down on its face. They've been quietly working on things inside Google, and you know, like Google Cardboard is their tiny little device, and the one thing they've been talking about a lot is there's the application where a doctor used cardboard to give a diagnosis. I don't know if you saw the story. It was a nice like heartstring story that Google's talked about a lot, and I think that there are those kind of like enterprise applications in healthcare, and I know Google Glass, like its next iteration, is probably going to focus a lot more on the enterprise. So I think there'll be some really fascinating applications with virtual reality coming out of Google. It's going to be really fun to see what they do to compete with Facebook and possibly Apple, that's also working on something.
No, those are great. Listen, Mark, I want to thank you for braving the Super Bowl gauntlet today to come and join us on MedHeads. You know, we're close to our time limit. At the end of every MedHeads, we kind of go around the horn and talk about one story they thought was amazing in the business of healthcare. Mark, as a pure tech guy, you can even expand that into your favorite story out of anywhere in the business of tech, right? But Meghana, why don't we start with you? What was your favorite story of the week this week?
I was kind of fascinated listening in on the Martin Shkreli / drug pricing hearing in Congress yesterday. That was, wow, politicians hate him so much, and their rants were amazing. So
he gives them every reason to.
What's that?
I said he gives them every reason to hate him.
Oh yeah, that guy is something else. But you know.
I don't know if any of you are gamers. I'm a bit of a gamer, and XCOM 2, one of the most anticipated games, came out last night. I unpacked it. I'm going to go home. You can make characters. I'm going to make a Martin Shkreli character as a dark VIP, which is basically an enemy alien collaborator, and I'm going to play him in the game. And I may kidnap him. I might blow him up. I haven't decided yet, but yeah, Shkreli. This is the year of Shkreli, right? So that's an amazing story. Stephanie, what about you?
I wrote about a company this week that got some new funding called Pear Therapeutics. And what I find interesting about them is that they bill themselves as a digital therapeutic. They're pairing an app with medication but focusing on areas that actually haven't really gotten a huge amount of attention in the digital health space, particularly like substance abuse, drug addiction, opioid abuse, and they're submitting their first digital therapeutic for approval in the first half of 2016. So it's interesting. They're following in the footsteps of Proteus Digital Health, it seems like, which have also submitted a joint application, but focusing on schizophrenia with a Japanese pharmaceutical company. And they're actually waiting to hear back from the FDA. They submitted this late last year.
No, my pick was Neil Vercel just wrote today about an interoperability manifesto, right? Again, I mean, we talked about so much about technology today. One of the big challenges in healthcare remains interoperability and the ability for everything to talk to one another, and purposely avoiding that. Despite government mandates, despite well-intentioned private collaborations, it's still basically going nowhere. And so now you've got a grassroots effort to build a manifesto that might force some of the private sector collaboration that is going to be required. It's going to be required to deliver better care through, a patient digital dashboard, home health, and a whole lot of other areas that, again, bandwidth is important, the right technology is important, but that idea of interoperability is the deal killer for so much of what happens in healthcare. So I like to hear about the grassroots efforts happening in interoperability. Mark, what about yourself?
This one's kind of boring, but it's I think it was a couple of days ago now, Google's SVP of search, the guy who runs their entire search operation, retired, and Google appointed the head of their AI research program. Basically, it's been a trend happening the past couple of years where they've been starting to put a little bit more machine learning inside search, but now they're basically handing off the keys to what remains like the most powerful part of Google and the web to AI and machine learning, which is, I think, like, I'm not entirely sure what the implications are yet, but I think they're going to be pretty massive.
That's fascinating. I don't think that's boring at all. Well, and again, Mark, I want to thank you very much for joining us here on MedHeads. I want to thank Meghana and Stephanie, as always, joining MedHeads. I hope you come back again and enjoy us next week. Actually, next week we're going to bring on some of the most promising digital health startups in the country, in which they're going to talk about some of the challenges in raising capital in the modern environment. A critical and hopefully empowering conversation that will make it easier and better for early stage companies in the tech side, health tech side, to make things happen. So for Mark Bergen, for Meghana Keshavan, for Stephanie Baum, I'm Chris Sepper. Have a great weekend. Bye, Martin.